Snoring can disrupt marriages and cause serious health problems. Call Sleep Better Northwest first, the experts in dental sleep medicine. Their medically approved, custom-fit oral appliances will have both you and your partner sleeping better and being more productive throughout your day. Don't wait. Snoring and sleep apnea can signal potential strokes or heart attacks. For more information, visit needbettersleepnow.com and download our health guide today. Sleep Better Northwest, the experts in dental sleep medicine.
Better health, better care, lower cost. Everyone's talking about health care, but how much do you know? Better Health is brought to you in part by Sleep Better Northwest. Explore the healthcare system and listen to experts with your host, Sue Lonnie Madsen, here on Better Health.
Okay, well, welcome to this edition of Better Health. And I have as guests today two representatives from one of our sponsors. From Sleep Better Northwest, I have Dr. Erin Elliott and Dr. Rob Heinrich. They're both dentists, and welcome to Better Health.
Thank you.
Well, it's not just going to be an infomercial for your business. This is really a good discussion on some serious issues in healthcare and some issues that kind of bridge between dentistry and the typical general physical health practice. It's alluded to in one of the opening sponsor positions on the importance of treating sleep apnea. And what are some of those conditions that can be a problem if it's untreated?
Well, I'll take that one. So when somebody struggles to breathe at night, and if they've been diagnosed with sleep apnea or have a potential to have sleep apnea, one of the biggest concerns we have is the effects on the heart and how the heart has to work harder to pump blood and oxygen to the organs and to the brain at night. And so those patients that have sleep apnea or risk for sleep apnea have a higher risk of cardiovascular problems, cerebrovascular problems, strokes, heart attacks. Those are the two big ones that we get concerned about. So other problems, hypertension, high blood pressure, but increased risk of heart attack and stroke are the two ones that they're the big ones.
Okay, so there are serious long-term health implications, and this is way beyond somebody being concerned about snoring. That's maybe a symptom, but not the problem.
Correct.
Yeah. Well, one of the things we talked about a little bit before we sat down here was how is it diagnosed? And this is something that my understanding is it's often diagnosed as a medical condition as opposed to a dental condition, but it's that in-between sort of stage. Dr. Elliott, what are some things that you would look for as a practitioner?
Well, as dentists, I really feel like we're on the front lines because we tend to see our patients more than,
more frequently,
than a primary care physician. And some of our dental patients don't even have primary care physicians. They'll go to the urgent care if they're sick. And so our hygienists, we spend at least an hour with them. And then, of course, if they have restorative needs, we're staring at airways all day long. So we can see some of the effects in the airway, floppy tissue, large uvula. If they have a small collapsible airway, that's obviously a bridge to a conversation about how they sleep at night. But even in the teeth themselves, acid reflux is one of those diseases or GERD that we see with untreated sleep apnea. And that's because as the patient's trying to breathe at night, the acid is literally vacuumed out of the stomach, and we can see the erosion in the teeth. Also, we see the effects of mouth breathing or nasal obstructions, and we see grinding of the teeth and clenching of the teeth. They're finding in studies that 80 to 90% of bruxing or grinding is actually the body's way of opening up the airway at night. So we see, like I said, a large scalloped tongue, a creased tongue. There's many signs and symptoms in the mouth. And so we're almost like detectives. We're not just tooth mechanics anymore. And so we can tie those signs and symptoms to how they're sleeping at night. Many times patients look at us like we have two heads, that why are you talking to me about sleep? You're just a dentist. But we can see it so clearly.
Well, your training is totally focused. As you said, I hadn't thought about it. You're looking at airways all day. You are well focused on that. And you do have more time in a regular dental appointment than any MD or ARNP is going to have with a patient.
Well, and for so long, we have been connecting oral health, even periodontal disease and inflammation, to total body wellness. And this is just one more piece of that total body wellness that dentists can be a part of. And they're even connecting periodontal disease and inflammation to sleep apnea as well.
Well, we do have a lot of issues of kind of scope of medical practice that is, we have dividing lines that are drawn because of old ways that each profession developed, but they don't necessarily make sense for an entire human body as one piece. Have you heard some of your patients when you suggest this, are they afraid of what they might end up with, and that's why they've put off seeking treatment?
Yeah, absolutely. And so there are different barriers to treatment, or perceived barriers to treatment. Number one, the sleep study and how that's done. And most patients are aware of the fact that, or believe that they have to be an overnight study in a hospital. And that's not so much the case anymore. A lot of the sleep studies to diagnose sleep apnea are done in the home, and so they're fairly benign for the patient. And then the other barrier is they believe that the only form of treatment is going to be the CPAP machine with the mask and the hoses. And there are other options available, namely the oral appliance that Dr. Elliott and I do. So we do get those obstacles that patients come up with quite often, and we try to make it as easy as possible for them. But I think there is that stigma of the overnight stay in the hospital with somebody watching you sleep.
That just sounds freaky to begin with, right?
It is, and it is quite an experience. And then the fact that they feel like they have to have a CPAP, and as much as we support CPAP 100%, and it is the gold standard for treating sleep apnea, the fact is that the patient does have options, especially if they're in the mild to moderate division of sleep apnea.
I think also one of the barriers is probably financial, and thinking that it's this huge cost. But, especially in what we have provided our patients, is we really try to minimize the out-of-pocket and emphasize the fact that this is a dental solution to a medical issue. Therefore, medical insurance covers it. I rarely see a medical insurance that does not cover an oral appliance. And when they do cover it, it's usually for 3 years with not a whole lot of ongoing costs like CPAP has, where you have to get new parts and hoses and masks and all that. So really, if you think about the price of a good night's sleep, it's a small price in comparison.
Okay, so there's a range of options for treatment. I think everybody Googles when they want to see what the range is. And I was surprised actually at the range of options that was mentioned. Several of them were more along the dental appliance side than just the higher tech machine side. So your practice provides a particular kind of dental appliance, and perhaps you could describe a little bit about what that's. What that is? Can we picture it?
There's over 120 different FDA-approved appliances.
Oh wow!
And then there's a whole category of snoring appliances, which means that these infomercials and online gimmicks, or I don't know if you've heard the commercial for Zipa, you hear it all the time. Those are direct to consumer. However, they're usually boil and bite, not custom made, not adjustable, real bulky. So I don't want those appliances to, pun intended, put a bad taste in our patient's mouth as to if that's what the appliances we provide are like, and they're not. We're custom-made oral appliances, adjustable, and we use really the highest quality out there. Some appliances have a 30-day warranty. Ours that we provide have a 3-year warranty, except against terriers that tend to to use them as a chew toy. But we really do provide what we feel is the most comfortable and long-lasting appliance for our patients.
And there's about, I would say, between maybe 4 and 5 appliances that we use that depending on the condition of the patient's mouth, the size of the mouth, the size of the tongue, whether they're grinders, whether they're bruxers, Dr. Ellen and I are able to help the patient
really customize it,
decide which appliance would work best for them. So it's but we do tend to steer away from those boil and bite sort of one-off internet type of appliances. And
Or the cheapest ones available
Right.
to us dentists. It's not about our bottom line really as far as lab bill. It's more what's best for the patient.
So there are options. I have to admit, I tried one of those boil and bite things once because I do tend to grind my teeth, and I felt like I was getting ready to play rugby. It was just was not going to work
Right.
at all. So, well, I think we've got a break coming up here, and when we come back from the break, we can talk a little bit more about how we can, how you work as part of the medical team to provide this treatment to patients.
In touch, online all the time. SpokaneTalksOnline.com.
Snoring can disrupt marriages and cause serious health problems. Call Sleep Better Northwest first, the experts in dental sleep medicine. Their medically approved, custom-fit oral appliances will have both you and your partner sleeping better and being more productive throughout your day. Don't wait. Snoring and sleep apnea can signal potential strokes or heart attacks. For more information, visit needbettersleepnow.com and download our health guide today. Sleep Better Northwest, the experts in dental sleep medicine.
See you tomorrow night, and thanks again for taking care of the painting.
I got this.
Bye.
Weekends are made for painting. Let the experts at Rada Paint take care of you.
Hi. This looks amazing.
Rada Paint, over 80 years of quality, tradition, and trust. Find it in every can.
Okay, well, we're back, and we decided we'd like to cover a little bit about just exactly what sleep apnea is and how it may or may not be related to somebody snoring. And I'll have to tell you, I just got off of a 10-day family vacation on a canal boat, which is basically like an RV on the water with 8 members of the family, and we decided 3 of us snore. We all, however, sleep very well through that, so it wasn't a problem. But maybe I should be talking to them about something. So how is there a relationship between snoring and sleep apnea?
So I think it's important to note that not everyone that snores will have sleep apnea, but a very high percentage does. And that's usually where the conversation starts, is with the complaint of snoring. And so when we find somebody that snores, and that's their chief complaint, we do discuss with them what sleep apnea is. And so when a person snores, that's basically the rumbling of the soft tissue in the back of the airway, the back of the throat, the upper airway there, making that noise. And so
Kind of like a flapping tent, kind of.
the soft
Okay.
palate, the tongue, the uvula back there, maybe some tonsils. And so when we see that, or we discuss with them their snoring, we then talk about other symptoms they might have, as some daytime tiredness, and we get into a conversation about what sleep apnea is. And so to try to keep it very simple, you can have a complete closure of the airway. The hose is completely kinked off. There's no water flowing through that hose, and so that's a complete closure of the airway, and that's called an apnea.
But that's just at night.
Yes, just at night. We're talking about sleep apnea while they're sleeping. And usually, patients don't know that they have a complete closure of the airway. It's usually a bed partner that will complain or that will notice that they've stopped breathing. And then you have a partial closure of the airway. Okay, we call that a hypopnea. So the airway is not completely closed, but a partial closure of the airway. The hose is kinked a little bit, but you still have a little bit of airflow. But what happens with those repeated kinks or partial closures is the blood oxygen decreases. As that blood oxygen decreases, the oxygen to the organs, and especially to the brain, decreases. And so you have hypoxemia that can occur. And so that happens over and over and over each night. And so that's kind of what happens during sleep apnea. And then that snoring is those partial closures of the airway. And then obviously a poor night's sleep creates inflammation. The body, during sleep, we want to rest ourselves. We want to rejuvenate. Certain hormones are released to get us ready for the next day. And when we're not sleeping well, we get tired, our organs get run down, it creates inflammation in our bodies, which can create a whole host of of systemic problems. And so that's basically what sleep apnea is, obstructive sleep apnea.
Yeah, instead of resting, we're kind of activating that sympathetic nervous system, which, really is cortisol, or the stress hormone. And I think Americans are stressed enough. We don't need to be stressed during sleep too. But most people are really unaware. I know we make a lot of jokes about snoring. My husband videotapes me and puts it on social media to start a joke. But it's really not that funny. Snoring is not benign. It's not something to joke about. It's something really to get checked out for. And we have people that swear all they do is snore, or they only snore when they're sick and things like that. But it's really important to screen that with the home sleep study. You can't tell just by looking at someone whether they have sleep apnea or not. I think that we had a physician in our chair, and I heard my hygienist talking to him about sleep apnea because he had some signs and symptoms. And of course, no, I'm fine. I sleep just fine.
Doctors are terrible patients anyway. We all know that.
Yeah, people say they sleep just fine, but because they don't wake up. And they really underestimate how tired they are. It's such a slow progression that they don't realize what a good night's sleep is, because that's their norm. And once they get a good night's sleep, all of a sudden, the eureka moment, they're like, wow, I didn't know how tired I was. So this physician said, or my hygienist said, well, I wear an appliance, I have sleep apnea. And he looks at her, but you don't fit the profile, because there is no profile. The profile to a lot of physicians is the large, overweight, old man.
Yeah.
And so those men get caught. It's the petite middle-aged woman that struggles with insomnia that you would never guess have sleep apnea, but I've seen some really severe cases in people that you would never suspect. And their chief complaint was not snoring, it was insomnia. And what did their physician give to them?
Something
sleeping
for
pills.
Sleeping deeper, which is not going to help.
So it's kind of a bad cycle. So like I said, it's really fun for us to be on the front lines and connect those dots for patients. And really, it's a holistic view, as good sleep is kind of the root of all other diseases. And we're supposed to get a certain amount of deep sleep each night. But each time we have one of those interruptions or kinks in the hose, it takes us from a deep stage to a light stage, and therefore, and not awake. So people think they're sleeping through the night, but they're not getting that deep, rejuvenating sleep that their body desires.
So the reason that the hose isn't a problem during the daytime is that your brain is more active, and it's just keeping things going. You don't forget to breathe. Pretty much, it's just it's the at night that's the feedback loop's not there.
Although, we're trained to see these things, and when patients, even during the day, we will see patients that tend to posture their lower jaw forward a little bit, and we can see that when we do our dental exams. They'll have wear on their front teeth, so their front teeth are flat. Maybe not a lot of wear on their back teeth, but if you see people kind of or their
even a head forward.
Yep,
head
they head forward like this. And so sometimes we'll see these people even walking down the street, and we can see those people pretty easily, pretty clearly, suggestive of a possible airway issue. And by posturing their head forward or pushing their jaw out, they're opening up that airway. So during the day, they're not closing off, but they're posturing. They're struggling to keep that airway.
Compensating.
A smaller chin and a turkey waddle are dead giveaways as well.
Interesting. So, because this is looking at the body holistically, so you're practicing as a dentist, and as you said, you had a physician who was in the seat. How do you work with physicians with a particular patient? What are some ways that plays out for a patient? If they have a regular family physician that they see all the time, how would you approach that person?
We kind of become their quarterback for this. I'll let Rob kind of.
Yeah, we can take the patient any way that they prefer. We will get referrals straight from the sleep doctor for patients who have tried CPAP and the CPAP is intolerant. We refer our own dental patients, like Dr. Ellett explained earlier. We see that there's a possibility of a high risk of sleep apnea, so we will recommend them seeing their sleep doctor. We can screen them ourselves with our own home sleep testing. We get referrals from their primary care, or Maybe the patient feels more comfortable discussing this situation with their primary care first before they come back and see us. So any way the patient feels comfortable being treated or being being referred, we can do that for them.
Are there some barriers you find with medical health insurance or dental insurance as to some things somebody should be careful of as they figure out what's going to work best for them? Questions they should ask, I guess.
Yeah, go ahead.
Dental insurance is completely out of the picture.
Okay, so that doesn't apply.
It does not apply at all. With medical insurance, there's a lot of hoops, but we have learned what those are and overcome those hurdles. That a lot of it requires pre-authorization, referrals from physicians, but that's the things that we do in the background for our patients.
You have someone in your
collect
back
all
office that can help navigate that.
And most physicians in our area, that's why I partnered up with Rob. He's in North Spokane, I'm in Post Falls, and see a lot of people in the Valley, and of course he covers North Spokane. So we are able to work with physicians, and they're very familiar with what it is we do, because patients are asking each and every day for something other than CPAP, or they're asking for help with better sleep or snoring. So I think of us as evangelists almost, really trying to get patients the help that they need. Like I said, with medical insurance, there's times that the patients have to try CPAP first, have a trial of CPAP. However, no medical insurance can tell me what a trial of CPAP consists of. So there's still a writing policy, but we are there to help guide them, really.
Okay. I know there was some information that I got from a provider of durable medical equipment on issues that he has with some programs, with how they will reimburse or bill for. And he said there's actually some that will require trying something else before CPAP.
Yep.
So it could go in any number of ways.
Yeah, it is considered durable medical equipment, and Medicare since 2011 has covered it. Also, even in the American Academy of Sleep Medicine, the Physicians Sleep Doctors Academy, in their practice parameters since 2005, oral appliances can be used as first-line therapy, meaning you don't need to try CPAP first in mild to moderate cases. So appliances have been on their radar since 2005. However, I think it's still the younger sleep physicians and that sort of thing are more practiced with it, or more versed with appliances.
Well, that's kind of true as any treatment comes in. Those that are most recently bumped into it in school are going to be a little more comfortable with it than someone who's been practicing
it's
for
more
a while.
it's more familiar.
It's more familiar.
Mm-hmm.
It's more familiar.
It's not this foreign concept anymore.
So working with your insurance company on approval, it may be something you need to get a pre-authorization, but Better Sleep Northwest has excuse me, let me get that the other way around. Sleep Better Northwest, which will help you get better sleep, does have people on staff who can help with some of those questions.
Absolutely.
And any last kind of recommendations you'd like to make to people? What are the top 3 things that they should be thinking about that should trigger them to either start this conversation with their dentist or with their physician?
Well, I would say number one, the cardinal sign of sleep apnea is snoring. So if you know somebody who snores, then they should start a conversation with either their primary care doctor or us. They can email us. One thing I would like to say real briefly as well is that we don't necessarily treat children for sleep apnea, but we do screen them. And I think I want to say something real quick about kids and children.
Okay. I hadn't even thought about kids and sleep apnea.
And so, that's something that Dr. Elliott and I are very passionate about too, is children. And even though we don't treat them, we do make referrals often. And, for parents to know that if their child is, number one, very tired during the day, or actually maybe very hyperactive during the day, or makes sounds at night that sound like snoring. It doesn't have to be an adult type snoring, but
even heavy breathing.
Heavy breathing, a child.
Restlessness in sleep.
Yeah, restlessness. There's a whole host of things. They grinding their teeth at night, if severe wear and grinding or acid erosion, like we spoke of earlier. Those kids need to be seen. And unfortunately, I love our pedodontists, those children dentists. They do a great job. But I like to have parents ask more questions if their kids are grinding their teeth, if they're making noises at night, if they're not sleeping well, if they're hyperactive or tired during the day, don't want to go to bed, restless at night, wetting the bed into an age that they shouldn't be. Talk to their pediatrician, talk to their pedodontist, and if they don't get the answers they want, Dr. Elliott and I are happy to help
the
out.
usual course of treatment is tonsil and adenoid surgery, because it's an airway obstruction issue, and it's usually with that. But it kind of starts a bad cycle of mouth breathing, frequent earaches. It is not about sore throats at all. It's about getting deep sleep that children need. And there's some people in this country that don't even believe ADHD exists, that it really is all sleep related. So before you put your kids on Ritalin, ask the question, how do they sleep? And so many parents tell me that they sleep just fine, but really, are they? They may get the right quantity. Are they getting the right quality?
That's an excellent question. Certainly, we've all heard a lot, and it just intuitively makes sense that you have to have that good sleep for children as they're growing, and more sleep, and not interrupted by electronics or bad.
And then
bad oxygenation.
The one other thing that you asked for the top three. So Rob touched on the snoring. Also, if you have unexplained high blood pressure, or your blood pressure is higher in the morning. Also, I had a patient today, that was her chief complaint. Insomnia, where you do feel like you need to take a sleeping pill to get through a night, or even fatigue, where your thyroid is okay, bioidentical hormone therapy, if you're looking into that. Really look at why are your hormones maybe out of kilter.
Look deeper than the symptoms, and a good night's sleep is the root of good health.
Yeah.
Okay, well, I appreciate this conversation. I learned a lot, and thank you for coming.
Thank you.
Yeah, thank you.
Better Health with Sulani Madsen is produced in Spokane, Washington by SpokaneTalksOnline.com, which is solely responsible for its content. Better Health is brought to you in part by Sleep Better Northwest. Ask Sulani a question, recommend a guest or topic, and hear this program again online anytime at SpokaneTalksOnline.com. Cheers to better health, and thanks for listening.
Snoring can disrupt marriages and cause serious health problems. Call Sleep Better Northwest first, the experts in dental sleep medicine. Their medically approved, custom-fit oral appliances will have both you and your partner sleeping better and being more productive throughout your day. Don't wait. Snoring and sleep apnea can signal potential strokes or heart attacks. For more information, visit needbettersleepnow.com and download our health guide today. Sleep Better Northwest, the experts in dental sleep medicine.